Did you know that lack of sleep can destroy your life? Yes, you heard it right. Sleep isn't just a luxury, it's a necessity. It's as crucial to our survival as the air we breathe, the food we eat, and the water we drink. Sleep is an intricate and vital part of our daily cycle. It's the time when our body switches gears from the hustle and bustle of the day to the quiet and restorative phase of the night. During sleep, our bodies are hard at work, repairing tissues, regenerating cells, and recharging the mind. Think of sleep as the night shift of your body's daily operations. It's when your body's maintenance crew gets to work, fixing the wear and tear from your day. It's when your brain sorts and files away the day's experiences, converting short-term memories into long-term ones. Sleep is also the time when your body's defense system is bolstered. A good night's sleep strengthens your immune system, helping fight off infections and diseases. It's like your body's own personal army getting ready for the next day's battles. But what happens when we don't get enough sleep? Well, the results can be disastrous. Chronic sleep deprivation can lead to a host of health issues, from obesity and diabetes to heart disease and stroke. It can affect your mood, causing anxiety or depression. It can also impair your cognitive functions, affecting your attention, concentration, and problem-solving skills. On a societal level, lack of sleep can lead to serious consequences. It's been linked to numerous accidents and disasters, from car crashes to industrial accidents. Imagine a world where everyone is sleep-deprived. It's not just a public health issue, it's a public safety issue. So, let's not underestimate the power of a good night's sleep. It's not just about feeling refreshed and rejuvenated the next day. It's about maintaining our health, our cognitive functions, and our overall quality of life. So, lack of sleep doesn't just make you feel tired, it can actually harm your health. What happens to your body when you don't get enough sleep? When we sleep, our body gets the much-needed rest to repair and rejuvenate itself. But when we deprive ourselves of sleep, this essential maintenance work gets disrupted and our body pays the price. Let's start with the immune system. It's our body's defense mechanism against diseases. Sleep deprivation weakens it, making us more susceptible to infections and illnesses. You may find yourself catching a cold more often or taking longer to recover from a simple flu. Then, there's the cardiovascular system, the heart of our body's operations, literally. Studies suggest that chronic sleep deprivation can lead to higher risks of cardiovascular diseases. It's linked with hypertension, increased heart rate, and higher levels of certain chemicals linked with inflammation, which may put extra strain on your heart. And it doesn't stop there. Lack of sleep also impacts our nervous system, the communication network of our body. Sleep allows our nerve cells to rest and repair themselves. Without enough sleep, they may not function properly, leading to decreased concentration, memory issues, and even mood swings. But it's not just the physical health that's at stake. Our mental health takes a hit too. Constant sleep deprivation can lead to anxiety and depression. It's a vicious cycle. You're anxious because you're not sleeping well, and then the anxiety keeps you up at night. And there's more. Research suggests that long-term sleep deprivation could increase the risk of obesity and type 2 diabetes. When we don't sleep enough, our body releases more of the hormone that signals hunger and less of the hormone that signals fullness. So we may end up eating more than necessary, leading to weight gain. Sleep deprivation is not just about feeling groggy and irritable the next day. It's a serious issue that can have far-reaching implications for our health. So, it's essential to prioritize good sleep as part of a healthy lifestyle. Clearly, the consequences of not getting enough sleep can be severe. But what if your lack of sleep isn't due to lifestyle choices, but a medical condition? Let's delve into this. There are a variety of sleep disorders that could be standing between you and a good night's sleep. Firstly, we have insomnia. This is a sleep disorder where people have trouble falling asleep, staying asleep, or both. They may wake up too early in the morning or feel unrefreshed even after a full night's sleep. Insomnia can lead to daytime sleepiness, lethargy, and a general feeling of being unwell. both mentally and physically. Next up is sleep apnea, a serious sleep disorder that occurs when a person's breathing is interrupted during sleep. This can lead to repeated awakenings throughout the night, leading to fragmented and unrefreshing sleep. Over time, sleep apnea can result in serious health complications like high blood pressure, heart disease, stroke, and diabetes. Let's not forget about restless legs syndrome. This is a neurological disorder characterized by an irresistible urge to move one's legs, usually occurring during periods of rest or inactivity, particularly at bedtime. As you can imagine, this can significantly interfere with sleep, leading to daytime fatigue and other health issues. Finally, we have narcolepsy, a chronic sleep disorder characterized by overwhelming daytime drowsiness and sudden attacks of sleep. People with narcolepsy often find it difficult to stay awake for long periods, regardless of the circumstances. This can make everyday tasks difficult and can lead to serious life consequences. Each of these conditions can seriously disrupt your sleep and over time can contribute to the health problems we discussed earlier. They're more than just an inconvenience. They're a serious threat to your health. But the good news is they're also treatable. With the right diagnosis and treatment plan, you can manage these conditions and improve your sleep. If you're struggling with sleep, it's possible that you may have one of these conditions. It's crucial to consult with a healthcare professional if you're experiencing ongoing sleep issues. You don't have to live with poor sleep. There is help available, and it starts with understanding the potential underlying diseases. So, what causes these sleep disorders? That's a question that's on many minds. The causes and triggers of sleep disorders vary widely, but let's delve into some of the most common ones. Stress, for instance, is a significant culprit. Whether it's work-related, financial, or personal, stress can rob you of a good night's sleep. This can lead to a vicious cycle, as lack of sleep can also cause stress, leading to even more sleepless nights. Poor sleep habits also play a significant role. Staying up late to binge-watch your favorite shows, eating heavy meals before bed, or not having a consistent sleep schedule can all contribute to sleep disorders. These habits disrupt your body's internal clock, making it harder for you to fall asleep and stay asleep. Next, let's talk about medical conditions. Certain conditions like heart disease, diabetes, and depression can cause sleep disorders. For some, the discomfort or pain from these conditions can make it difficult to sleep. For others, the conditions themselves disrupt the sleep cycle. Ever thought that your medication could be the culprit? Certain medications, especially those for high blood pressure, heart disease, and depression, can interfere with sleep. It's always advisable to talk to your doctor if you suspect your medication is affecting your sleep. Genetics can also play a role. Just like eye color or height, your tendency to have sleep problems could be something you inherited from your parents. Certain genetic mutations can cause conditions like insomnia and narcolepsy. It's crucial to remember that many factors can contribute to sleep disorders. Often, it's not just one single cause, but a combination of factors that lead to sleepless nights. Moreover, these factors can influence each other, creating a web of complexities that can be challenging to untangle. That's why it's essential to identify these causes and triggers. Understanding what's behind your sleep disorder can help you manage it effectively. The more you know about what's causing your sleep troubles, the better equipped you'll be to tackle them head-on. Identifying the cause of your sleep disorder is the first step towards managing it. What can you do if you're struggling with sleep? If you've been tossing and turning night after night, it's high time to seek professional help. Persistent sleep problems are not to be taken lightly. They can be a sign of an underlying health issue that needs immediate attention. Let's explore some of the various treatment options available. First, lifestyle changes. This could mean establishing a regular sleep schedule, limiting your caffeine intake, or creating a restful environment that helps you relax before bedtime. Small changes can make a big difference. Next, therapy. Cognitive behavioral therapy, also known as CBT, is a common form of treatment for sleep disorders. It helps you identify and change thought patterns that lead to sleep problems. It's not an instant fix, but it's a long-term solution that can help you manage your sleep disorder effectively. Then there's medication. Prescription sleep aids can be an effective short-term solution for some individuals. But remember, they're not a cure-all and should be used under the guidance of a healthcare professional due to potential side effects and dependency issues. In rare cases, surgery might be an option too. For instance, if you're dealing with a severe case of sleep apnea that hasn't responded to other treatments, a surgical procedure may be recommended. But keep in mind, it's typically a last resort and not a first-line treatment. Finally, the most important step you can take is to talk to your healthcare provider about your sleep problems. They can guide you through the options and help you decide on the best course of treatment. Don't be afraid to reach out and ask for help. Sleep is a vital part of our health and well-being. If you're not getting the rest you need, it's crucial to seek help and find a solution. It might be a long road to recovery, but remember, every journey begins with a single step. Remember, a good night's sleep isn't a luxury, it's a necessity. Don't let lack of sleep destroy your life.